The meeting is being live streamed. So hello everyone who might be catching this first literally seconds of the live stream. It's showing that we're live on Facebook. So if you're here for the noon free webinar on EMDR and LGBT experiences, you are more than in the right place. I would ask you to all hang tight while we give some of our friends a few minutes to find us. But something before I formally introduce the panel, we can chit chat about a little bit. And I'd like to do this for connection because we're joining from all over in different places. What's the weather report where you're at in your part of the world? So I am in Northeast Ohio and we're actually having real summer. It's nice for once. I was already out in the sunshine and swimming this morning. So that's my report here in Ohio. What about the rest of y'all?
Well, way up here in Canada, Victoria, BC, it's a typical West Coast cloudy day, although we'll probably get some sun today. Thanks, Jamie, for putting this all together and everybody joining. This is wonderful to spend some time together and talk about this topic today. Appreciate it.
You're welcome. And yes, we're just doing a little bit of a weather report check-in right now while we're waiting for some of our friends to find us online. Danielle, how's the weather in Buffalo?
Well, we're sharing your wonderful Ohio weather in Western New York. It's sunny. I think it's going to be about 81 or 82 degrees today. So it's nice to feel that summer feel. And
Very
thank you
nice.
for putting this together, Jamie.
Oh, my great pleasure. And Patrick, how are things upstate New York?
Hey, New York is represented today. It's a beautiful summer day, not too hot as of now.
Patrick, I think you're muted. I'm not.
Oh.
Are you okay? Okay, you're good. Keep going. It's
okay,
my end.
Sorry. A beautiful, nice summer day. And once again, like everyone, thank you so much for putting this together. I'm so excited and honored to be here.
And Lisa, what
I'm like in central Ohio, so we don't have that much of a difference here from where you are, Jamie. But it's real hot here, which I don't love, but my garden is thriving in all the sun. So we've got plenty of fresh veggies going on in our house. So if you need any lettuce, by all means, please come to my home. Just sneak in my backyard and take some of the lettuce that's growing.
Love it. And what about you, Roshni? How is Southern California this morning?
Southern California, up and down, as always. It's about 64 now. Looks like it's going to be 80, maybe more, maybe hotter than that. We're coming into a heat wave, so.
Great. Well, so for those of you who are joining us live, looks like we have 55 folks with us live right now, which is amazing. So feel free to drop in the chat where you're joining us from in the world today. And if you want to give a weather report, you're most welcome. Looks like we're getting some spam in chat. So I would just say do your best to ignore that. I don't really have a way to address it right now. Other than while we're talking, I might be able to do some blocking. So yeah, feel free to introduce yourself and where you're joining us from in the world right now. So I want to welcome all of you to today's webinar, which is EMDR therapy and LGBTQ experiences. For those of you who do not know me, my name is Dr. Jamie Marich. I'm the founder and director of the Institute for Creative Mindfulness. I do a lot of online EMDR therapy content. I'm an EMDR trainer. I've written several books in EMDR. But as it relates to the topic of what we're discussing today, I am just Jamie. My pronouns are she, they. And I identify as a queer woman, specifically a bisexual or pansexual. I go back and forth with the identifiers. I'm a woman in long-term recovery from addiction and dissociation, and being able to really step into this authentic place has been imperative to my personal recovery. And I do think it has translated into what I've been able to do professionally. And it's really warmed my heart in recent years. And I think the pandemic has elicited this, at least this, I'll speak for myself, this desire in me to really take a deep look about who I am, what I stand for, and how that's reflecting in my professional life. And I've been happy to facilitate a lot of these conversations just about how all of us can do better as EMDR therapists, as EMDR trainers, as EMDR consultants, as members of a growingly diverse EMDR community. And I wanted to invite 5 of my friends along today for this conversation. So what I'm going to do is just introduce everybody. You can kind of wave your hand as I introduce you, and then we'll kick off with our first question. So first we have Roshni Chabra, who's joining us from Long Beach, California. Roshni, I met she came in as a student through the Institute for Creative Mindfulness and now works with us as a consultant and kind of co-collaborator with Steve Danziger, who's one of our senior faculty members. And also from ICM, we have Lisa Hayes joining us from Columbus, Ohio. Lisa is a longtime EMDR therapist, approved consultant, and Lisa has recently taken over not taken over, has established and is the director of ICM's special training program for BIPOC and clinicians of color, which we're just so excited that there's been so much interest in that. And then with the beautiful rainbow background, we have, I just smile whenever I see Patrick or think of his name. We have that kind of relationship. And I have to say, Patrick was my consultee when he was coming up doing his certified therapist status. And you know how it is that some days you have so many appointments on your calendar and you're seeing so many clients and so many consultees. But whenever I saw Patrick's name on my schedule for a day, my heart would just warm, because just the way Patrick says, "Hi, Jamie," would always just make my heart smile. And we've become friends, and Patrick now works for ICM, with ICM as an approved consultant and faculty trainee, and has a lot of great experience to say. And Patrick's also a emotionally focused couples therapist and does a lot in that realm. So if our conversation veers into that, that could be fun. And then I'm also happy to be joined by 2 of our friends from outside of the Institute for Creative Mindfulness, yet are great collaborators in a lot of these discussions. We have Sue Ganest in the bottom. I'm seeing her in my bottom. I don't know how she's showing on your screen. Sue is from Victoria, British Columbia. Sue runs her own training institute and organization, and I've gotten to know her better over this last year, really around having a lot of these kind of conversations like we're going to be having today. And last but not least, we have Danielle Godfrey, who practices in Cheektowaga, New York, which is right outside of Buffalo. And similar to Sue, Danielle works with another program, Child Trauma Institute. Yet we have also gotten closer this year, having a lot of conversations like the conversations that we're having today. So the first question that I'm going to toss out to the panel, and you can also use this as an opportunity to introduce yourself further if there's anything I may have left out, is how did EMDR come into your life? What has been your journey kind of evolving with EMDR? And, maybe what role has EMDR played in just helping you around issues of identity and taking up space in this world? So Roshni, I'm going to bat it to you first, if you don't mind taking the lead.
Sure, not at all. So before I became a therapist, I did some crisis work for about 5 years. And so I ended up having sexual violence be one of the specialties that I worked with my clients. And I found that people would get better and that they would have coping skills and things would get easier and they'd move through some of the trauma. And then one day they'd just be going along and it would be like it happened all over again and the triggers would be intense. And so I kept seeing that over and over again. I'd heard about EMDR and that's what made me want to explore it. And I've seen so much positive come out of it for my clients. I've been able to see clients really heal from not only sexual violence, but a lot of other trauma. So I drank the Kool-Aid pretty quickly on when I was able to see, wow, this really works. Like, this is actually something that can help people move on and think differently about themselves, kind of be able to shift their cognitions about the world. And so here I am.
Lisa, what about you?
Good. Hi, everyone. So my name is Lisa. I use she, her pronouns. Also, just in recognition of language, I use the word queer to refer to myself, and I know that that word holds different charge for different folks, just depending on the context in which they hear it. But that's language that I use to describe my own life. So you can just call me Lisa, though. EMDR. So yeah, I mean, I think I've been trained in EMDR for like 14, almost 15 years. And I think when I very first came to it, I had the great benefit to work with a community of clinicians, some of whom are also now part of the ICM family as well, who were super generous in their work, and they were willing to talk to me about what they were doing and what they were exploring and to introduce me to it. And so I think that generosity actually really created a warm space for me in EMDR therapy. But I was also coming to this mental health space from an undergraduate space of like gender theory and gender studies and sociology. And I was like looking for something different. I was kind of like burnt out on these traditional talk, kind of like rigid medical, pretty white, pretty male models. And so I was into it, like I was ready for something weird. And it just kind of found me, it worked, and so I think it's created a lot of space for me to invite some of that like organic person into a space and to allow my clients to really show up and to identify their own language and their own space and their own journey. And that's been quite a relief to me. It feels like it creates space as opposed to closes people in the therapeutic relationship. So I dig it.
Thank you. What about you, Patrick?
So I go by he, him, and I identify as gay or magical, depending on my mood. I don't know. I don't really go with labels a lot, but that's just me. So it's really funny because I had heard about EMDR, but then I had actually heard a lot of the misconceptions about it and kind of fell into that trap for a while. So I was actually quite resistant to it until I was in therapy. And I had an EMDR therapist who I asked not to do EMDR on me. And then one day I was stuck. That's the word that always, changed my life with EMDR. And she said, "Can I just try a little bit of tapping?" And I said, "All right, I guess I trust you." And in all sincerity, that experience changed my life. In that one session, I had such profound insights and healings and reactions, and it was so profound personally. And at the end of that session, I said, I need to learn this immediately. Not only for myself, but I need to bring this to my clients. And I think a lot of people that I work with in consultation say the same thing of, once you learn EMDR, it's kind of the question of, what was I doing before? And I think it really helped to teach me and educate me on negative beliefs, on how dangerous and damaging those can be to us and our spirit. And I think personally, it's just helped me to learn how to be healthier, how to keep going. And it's been an amazing adventure, and I absolutely love it.
Yay. And Sue, tell us a little bit about your process.
Thank you. So I go by the pronouns she, her, but I'm also very comfortable with they. I'm, working through ideas around identity. Although I've identified a long time as lesbian, I'm less, keen about the language and the words and pigeonholing things, and I'll talk about that later. But how I came to EMDR is really my own personal journey. So I knew very young that I needed to do my own personal work. And for a long time, I was involved in very conservative church, which had its whole background. And now I'm in this, 180 paradigm shift from that. So it was a healing process coming out of that. University certainly helped. But really, what really brought me to EMDR was my own personal healing journey. And at one point I said to my very capable talk therapist, "Feels like my head is in university and my body and my emotions are still in kindergarten." And she went, "I don't know what to do." So I started exploring body psychotherapies, and I've been doing that a few years longer than EMDR, all kinds of somatic approaches, which have really informed my EMDR work, but it still wasn't quite enough. And then in university, in my master's, I came across EMDR, tried that out both personally and taking the training, started hosting the trainings. And then it was that last shift that was really important. It was cleaning the box out, not just coping, not just working. The other pieces were incredibly important as a foundation, but it just got to the point where let's clean this box out. I'm tired of learning coping. Let's go to something else. And all of that background was incredibly important for taking forward. And so now what I do is teach what worked for me and what worked and has worked for hundreds of my clients and consultees and such. So that was a very important and powerful background to what I teach now, and the culmination of so many different approaches and influences with Indigenous elders and you name it, all kinds of different things that have set a foundation for me and made the work very personal and very powerful and exciting to be able to teach and be a part of. So that's how I came to the table.
Thank you, Sue. And Danielle, tell us about your EMDR experience.
Well, hi, I'm Danielle, and I use she, her pronouns, and I'm a transgender woman. I have been in the process of coming out socially transitioning for the last 18 months, approximately. So I have a longer road than most because I'm a little bit older. I grew up pre-Stonewall in a violent family in a very conservative religious environment. So as you might get, and I knew that I had a transgender identity at age 5 before the word transgender was used. But I knew that about myself. I was one of those 25% of the kids who know that they are at this age when you're in that younger cohort. So I learned very quickly within my family setting to keep my mouth shut about who I was and to suppress. And I had a lifelong pattern of suppression, which had significant consequences to me in my life. So as you might guess, I've been both a consumer and a provider of verbal therapy and EMDR. I did a pretty good job of sealing over those old memories. I was living a double life, though. I was really suppressing my true self, which is my identity as Danielle. Then I experienced a personal tragedy, which was traumatic. And it just kind of peeled away all the layers of what I thought was healing. It was kind of like if you ever have an old house and you open up a wall and you find out all this stuff there. I had to deal with that. And I had become an administrator. I was kind of cushioned by privilege. I gave that up to go back to clinical work. And what I found was, starting a new practice, who did I meet for clients were really who I found to be refugees from other practices. And most of them were people who had untreated trauma and had been misdiagnosed. And that's how I got interested in EMDR, because I started to work on, to find out how could I best serve the people that I'm working with. Meanwhile, I came to terms with the fact that I had this whole bunch of symptoms, which I was ignoring, and I got my own EMDR work done. So, I became a believer because when I went to the training, when I did my own work, I got this resolution to issues that I thought were chronic that would never be resolved. So EMDR helped me find myself and cherish myself as the person who I am. And that's my commitment to EMDR.
Thank you, Danielle. And that's a beautiful transition as well into our kind of next major question. Before I ask the question and throw it out to the panel, I just want to share with our friends who are joining us live, because there's quite a lot of you. If you do have any questions or comments, please feel free to put them into the chat. I think we have all the spammers blocked at this point. And according to what I'm seeing on Facebook, you're now seeing all 6 of us. I'm sorry, at the beginning it was just on speaker view. So you'll be able to get a view of that. So the question is, and Danielle, I really resonated with your metaphor of like see what's behind that wall. Like everything could look okay up front, but then once you get behind it. So how, in your experience, and you may share on this personally, professionally, or both, and we are going to unpack some of the problems, of course, in the EMDR community. Yet I first want to really focus on what EMDR can do, right? So in your experience, either personally, professionally, or both, how can EMDR, or how does EMDR help folks who identify as LGBTQ+? And the floor is open. Whoever wants to jump in first, just go ahead and unmute. Or I'll call on you.
I think it kind of what Sue was saying, some of the experiences, it connects the dots. unlike other therapy can do. And one of the things that I love about EMDR is no matter what intervention you're using, it's so natural when you're learning about the bilateral stimulation and how the brain works and the communication and, the different ways that our brain communicates and holds on to things. I just love how fast it is and how profound it is. Because I have people who come in and, in my experiences personally and professionally, who have done so much therapy, who have done different medications, who have done, gone to the mountain with the llama and still are in pain and still can't get over those obstacles. They can't heal those wounds. And then within a few sessions in some situations, they get that release, they get that freedom. And I think to me, that's what moves me every time of there's so much healing here. And it's such a natural process. And I think that ties in a lot. I think in the LGBT community, we see so much harshness and violence and abuse in so many different ways. And being able to offer this amazing therapy to help people heal their hearts, their minds, and their bodies on such a deep and profound level really moves me and changes me.
Thank you, Patrick.
Yeah, thank you for that. I think I would say the same thing that Patrick's saying. And there's something about EMDR, as I was saying about my personal experience, that starts to clean the box out and not just deals with coping. And I think for all of us in this community and the socialization that we've gone through and the cultural oppression and discrimination that keeps coming back around, and that each part, different members of our community get targeted, and then we go through another era of trying to help and support that particular part of our community and the diversity. EMDR goes beyond and past that and helps, I think, with the whole being. So mind, body, spirit, the entire being gets to be present and followed. If you have a good EMDR therapist who will follow the system, certainly helps to have a somatic and ego state dissociation background when you're working in EMDR. But the whole person can show up in EMDR, while at the same time, the therapist doesn't have to know the details. So that's also nice for the client. So if there are particular experiences that are difficult to speak about because of shame and the difficulty, like Danielle was talking about, that intensity of knowing at 5 years old and having this lifetime of oppression and closed down. And for me, I didn't even hear the word lesbian or gay until I was in the second half of my 20s. I think it was like 25 or something. I mean, even the little small redneck town that I grew up in, I never even heard the word. Nobody was even making fun of anybody being gay. It didn't exist, you might say. And we didn't have the internet. And it certainly wasn't in my encyclopedia so there just wasn't a language. There was no way to explain this or to understand this. And then being part of the Christian community added to that. And I just have found that EMDR sort of walks past all that and looks at and helps address the entire being. So if there's been spiritual abuse, if there's been emotional, physical, sexual, but in a way that you can really work with the individual, and you can work with the shame, or you can work with the social oppressions. So if you have a good therapist who is culturally competent, or at least open to learning and being kind and creating space, we have the opportunity to discover and move forward and clean some of those boxes out that have been really difficult for us for many, many years.
Great. And Lisa, I saw you were going to unmute as well. I just want to jump in and say one of our participants added, it was only until I resolved my NCs, negative cognitions, that I was able to live authentically. Just had that realization. So thank you for sharing that. Lisa, go ahead.
Yeah, that's beautiful. I just wanted to say to Danielle, you said this phrase, this lifelong pattern of suppressing. And oh man, it just like hit me right in a spot. So I just want to thank you for saying that, because I think when I think about using EMDR therapy in any community, but certainly communities that are facing this like constant request to like isolate or to suppress or to not exist or to fragment, right? Like I'm allowed to have this concern, but it's not something that someone's going to see the intersection of my gender, my sexuality, my race, my class, my, you know, all that kind of stuff. And I think EMDR therapy, in some ways, it helps to suspend the need for my therapist to get that or to understand it. And I think in traditional talk therapy, you know, I spent a lot of time trying to relate my lived experience almost to like legitimize it in this very concrete cognitive way, right? Like, how can I explain to a person that this experience, right, it pokes and it pulls at this other kind of core belief that I am not safe or I'm not valuable or, you know, I'm not wanted. And I think using that time felt like another act of like oppression, frankly, right? That now I'm paying someone to try and communicate and convince and to kind of have them buy in to this larger narrative, right? And so, you know, because these spaces are predominantly white, because they're predominantly straight in their experience, you know, I was coming into this place needing to like really try and position my pain in a way that was comfortable, right? A way that someone else could consume. And I think EMDR therapy removes a lot of that burden, and it allows me to kind of like get at that core, you know, negative cognition. It allows me to express an experience and to know it like in my body and not need to convince someone or to rationalize it or make sense of it. And I think there's a kind of freedom in that, where certainly I think as EMDR therapists, there's a requirement that we are curious about other folks' experiences, right? And that we have an understanding of the nature of oppression and oppressive cognitions. Like, I don't think we get to not do that work, but I think for a client, for myself and my own work, it was such a relief to feel like I didn't have to try and convince you or to help you, to walk you in the path to see how it was all together for me. And my hope is that that's something that I'm also able to offer to folks who I certainly have never lived their lives either, you know.
Yeah. Roshni.
Yeah, I'll just add, I mean, I think that things have changed. Things always change. However, you know, a lot of us grow up feeling rejected. You know, unconditional love is a fleeting thing in general. But just knowing that there are parts of us that we can't share is very painful, as many of you have said. You know, the negative thoughts, the internalized homophobia, higher suicide rate in our communities, you know, very high rate of queer folks, trans folks ending up in foster care, which, as many of us know, is a ticket right to prison. So there's kind of the deck stacked against us. And I think that when we're able to go in and work on shifting these beliefs about ourselves, it really makes a huge difference towards self-acceptance. I think that, unfortunately, you know, the internalized homophobia is not the only thing. We're literally seeing our folks be killed. You know, we're literally watching this. We're right here on the 5th anniversary of Pulse, the largest shooting ever, I believe, in the US. And it's heartbreaking. And to think about, you know, that could be me. There's always that implication there. So what we believe about ourselves and what we think about ourselves is so impactful that, you know, for queer folks, it's really important to be able to find ways to address that.
Right. So Danielle, anything you want to add? Because I know when you introduced you kind of brought up this idea of what EMDR could do. Anything else brewing for you?
Well, so the majority of my clients that I work with are in their 20s and 30s. And so many of the transgender or non-binary clients that I work with are really recovering. The first part of treatment is really helping them to recover from their childhood and adolescence and their experiences that they had. So many come in and just think they're just broken and there's nothing that can be done to help them. And I think part of the role is really to give them hope and to explain what PTSD is, how it's different, because often in their systems, and I'm not going to call them support systems because often they're the opposite of support systems, they're getting the message like, you are so broken, you're crazy, you're this. And I think one of the things that we can do is provide hope. And EMDR works. And this is like the miracle. Like when I first, I know I was going away once for a couple of weeks, and I debriefed everybody, and I had my EMDR clients and my non-EMDR clients, and the EMDR clients, like 9 out of 10 people said, this has been life-changing. And the one person said, well, I'm not sure yet because I just got started. Those are dramatic results. And I think we can really provide hope, and we can provide that pathway of hope to so many people that we work with.
Thank you. And I would just like to add on a personal note, echoing what some of our participants shared in their introductions, that I also grew up in a very conservative religious environment that was the source of a lot of my oppressive cognitions. And I just want to give a shout out to Roshni Levis and Laura Siniago, who are 2 clinicians from the Bay Area that coined that term. And it is essentially negative cognitions with a deeper bite that really come from this place of putting people down for who they are, how they identify, what they were born into being. And the negative cognitions that we traditionally conceptualize in EMDR can have even more of that core visceral quality, because they carry the message of the oppressor right in the message. And the mine that I emerged from my youth with had a lot of religious tone to them. Like, I am an abomination. I even had to set up one, I am Satan's child, with a lot of the theology about going to hell, especially for being who I am. And I just can't say enough for the role that EMDR has played for me personally, in an earlier season of my life, and then even in a later season of my life. I mean, EMDR was the thing that got me over a lot of the hump around self-injury, suicidality, when I had about 2 years chemically sober. And then after that is when I got trained in EMDR, and then did my dissertation on EMDR, and then eventually became an EMDR trainer. But I would also be remiss if I didn't mention that here in the US, something happened in 2016 where a very oppressive figure was elected to the presidency, and seeing so many people rise up to support that was very much a trauma recapitulation for me, especially with a lot of anti-LGBT rhetoric accompanying that. And I had a pretty significant relapse in a lot of my symptoms, and I had to get back into pretty significant EMDR care at that point with an amazingly affirming therapist who not only understood the role of my sexual orientation and identity, but understood the impact of conservative religion on a lot of that. And as we start to unpack some of the problems in the EMDR community here in the next couple of questions, we do have to go there. Because on one hand, as somebody who still identifies as a person of faith, I am not anti-faith, but I do have serious concerns about people using their faith or their belief system as a tool of oppression. And I have even more concerns when those people are therapists. A question that I think could be a gentler transition into this area. It was a beautiful question, and I just want to share this. As a trans woman and queer therapist in my first year of practice with mostly trans people, I've had part 1 training in EMDR. I am now in the work and struggling with some complex clients. I haven't yet started consultation, mainly because I haven't found the right consultant. How would you go about finding a queer consultant, and what do you think are the most important things to know in the first year of this work? I'll just speak a little bit that when this is over, kind of in the show notes, I will put ICM's link to get, and that's where you can get to Roshni, Patrick, and Lisa for consultation. I'll also put up Danielle's link and Sue's link, because I just want to personally shout out that anybody I've invited on this panel today, I think are amazing consultants. And Danielle, I'm so happy that you as a trans individual are out there doing consultation, because I think like there's so many people like our participant who just shared their struggle, who really want and desire that kind of consultation. The only thing kind of politically I have to mention is if you are still only post part 1, like you said, a lot of training programs do have their rules that you have to stick with a consultant within their program to finish up your basic training at least. But that should be a question you ought to be able to ask your training director. I mean, I know that's the culture we promote in ICM, where people can send the director, send our office, send their trainer an email saying, hey, I am specifically looking for this kind of consultant. And if they can't provide it, you might be able to say, is there anybody close who can at least get me through this basic? Until then, when I'm on perhaps a certification track, I can work with, whomever it is I need to work with. Because I do think there's an art in finding a consultant that you click with as well. So part of it is, how do you go about finding a queer consultant? And I would ask your training program, most definitely. But the question I want to throw out to the panel is, what do you think, dear panel, are the most important things you need to know in the first year of being an EMDR therapist? Especially, let's just add, if you may identify as some dimension of LGBT plus.
Use the script. That's one of the things that I think so many people struggle with, but it's and so many people get so anxious, and there's so much insecurity and fear that comes up, which to me just demonstrates how caring the therapists are, because they never want to hurt their clients. That's what I hear over and over again. How will I know? And that's why when you're in the training, you're given those skills to help you build those muscles, that confidence, and also be able to, what I like is it shows that vulnerability to your clients. Hey, I'm learning this. I care enough about you, and I believe in this therapy that I'm learning it this way. And I think that brings a really beautiful humility into therapy. And when I was first learning therapy, I had it right there with my notebook, and all of my clients were amazing because they trusted me enough to know that if you're bringing this in, if you're trying to do this with me, that must mean you really believe in it, and I'm going to give it a shot. The other thing that I would recommend is just take your time, enjoy consultation, get consultation from different people, different perspectives. And even when you're done your 10 hours, continue with consultation. I think a lot of people that I see are in private practice, and even though there's so many amazing components to that, the isolation island that we get onto in private practice can really harm us in different ways. And making sure, all right, I still have these questions, I still have someone I can reach out to, I can still process this, and I'm not alone. Even when your training is done and your 10 hours are done, I know I still needed more, whether or not I went for certification. Like when I reached out to Jamie, I wasn't even sure I really wanted certification. I'm like, I just need someone to talk to. And I lucked out. But there's so many, all of the amazing people on this panel and all the other consultants that I know, that's what we're there for, to help and support you. So, always reach out. You don't have to do this alone.
Great. So what about the rest of you? Tips for people in their first year, especially if they are an LGBTQ plus therapist?
Well, Jamie, what I would add is, so first of all, the basic protocol works really well, okay? But you also need to learn, there are things that you need to learn about as you work with clients in the real world. The problem for many of us is, and I remember feeling this, is that without a consultant, this becomes overwhelming because there's so much out there. And it's really helpful. Sorry, that's my dog in the background. But
right.
It's really, she does not like delivery trucks. And even on a Sunday, they show up. But it's really important to guide that learning and not to overwhelm yourself because it's easy to do that. There's so much good information out there. But I think it's also important to be working with somebody more experienced who can really help you through that learning process.
Great.
Yeah, I think some of that feels true. I think when I heard Patrick talking, like some of what I'm always pushing in training and consultation is like EMDR therapy can be this really beautiful collaborative process where we can flatten some of those hierarchies that show up in therapeutic relationship, right? Where like I'm the person that knows all the things and you're the person that's coming to me for answers. I think that EMDR therapy can start to flatten some of those hierarchies and to redistribute power. And so I think some of that vulnerability that Patrick's talking about, right? Just to say like, hey, I need to read this. Or I sometimes will tell my consultants, you can say to your client, if it sounds like I'm reading this, it's because I'm reading this. Do you know, like I'm working on this or I'm developing a skill and I can hold vulnerability here and still have, a calming presence, and I can hold curiosity here, right? Because I think often when we're kind of selling this magic, to a lot of people, that's off-putting, right? If they feel like they've done a lot of work and they've not had success, and I feel really confident this can be helpful to them, like I can hold curiosity, and skepticism with you. Like I'm okay doing that. And I think sometimes when we're trying to like offer something that feels wonderful to people, I think often some of the consultants or the consultees that I work with feel like there's an additional obligation to like hold it in this space of like, it works, it's going to work. It's, and I think we want to support that, but also you can hold curiosity. Like, yeah, I don't know. Would it be interesting? Does it feel right? Does it feel comfortable? Does it feel safe for you today? Would you be willing to try something with me? And just to kind of operate a little bit more in that way. And then I also agree, have a good consultant, find one, surround yourself with people who like care about the work you're doing. And care about how you feel in the work.
Yeah, and Roshni, I want to hear from you on this because I know you have done LGBT specific consultation groups, and I know you have a lot to share on this too. What tips would you give to someone in their first year?
Yeah, generally I would say stick with it. I know it can feel kind of overwhelming, like a lot of information initially, but it does start to kind of come together if you just kind of follow it through, and it's exactly leaning on that script. Your clients are there to see you. And I think a lot that comes up for consultees is like, I don't want to trigger my clients. I don't want to cause harm. And then especially my LGBTQ clients, like they've gone through enough. I don't want to be triggering them. And so I tend to remind my consultees, you're not doing that. They've dealt with this. They know their trauma. We have to work through our own anxieties about what it's bringing up because it is a bit uncomfortable. We're used to kind of helping clients regulate, and at this time we're sort of activating them. And a lot of us say, the only way out is through. And just remembering, it's not about the numbers. If you never get to 0 and 7, it's okay. Your clients are still healing, and it does start to make more sense. And I would say EMDR is a really intuitive process, which is what I really enjoy, especially with my LGBTQ clients, because they start to feel that from you. So just being present as much as possible. And, as we've said, stick to the script. It will come together. Yeah.
Yeah. And I had a good technical question on this that I will ask the panel again in a minute. But Sue, I wanted to get your thoughts on this. Just advice you'd give to people in their first year, especially if they are an LGBTQ plus therapist.
So ditto with what everybody said. That one thing I would add, and I emphasize in my training, people come into the training, I forewarn them in the consent agreement that it could trigger their own past that they just in talk therapy may not have come up. And of course, then we get into practica and, pop, there comes things that they weren't expecting. And they're like, wow, I haven't thought about that for 30 years. So for me, I really emphasize everything that you've all said, as well as go and get your own EMDR therapy and support yourself. You don't need to carry that stuff anymore. And there's such incredible learning in doing your own EMDR when you're working with somebody who's really good. And many of us have had that experience. And that learning I've had in my own EMDR with a really good therapist, you can't read about that in an academic book.
Right.
You won't get it there, but you will get it in that therapy. And when that stuff gets activated in your training and you realize, wow, this is really important, as that question arose, I think I need somebody who understands my world and my diversity to help me with this. You also need that in terms of your own therapy so that we can transform and take that really important learning in our own healing.
Thank you. And to another question we're getting, but in the similar theme of what we've been talking about here, I want to be as diplomatic yet as honest about this as possible. That there are so many different types of EMDR training programs and cultures out there. And if you feel you're not getting your needs met in one, even if it's the group that you started your training with, it's fine, finish up the training there. But know that if you are going to pursue certification, or if you think that you want to at least do some additional consultation, like that's how Patrick found me, right? Needing like, hey, I need to hear a different side of this. So particularly if you are LGBTQ identified and you feel that what you need is not being met with where you trained, it doesn't mean your training base is bad, but just know that if you're proceeding, there are a lot of different kinds of programs out there and different kinds of consultants, and look at the websites of the different programs. I mean, I don't do this to placate, but I chose a rainbow logo for a reason, that I want people to know when they find ICM that, particularly because even amongst therapists, there can be a shutout to "you're not welcome here." I want people to know when they land on our webpage that, yeah, ask those questions. And even if you have a bad experience with one of our folks, we'll try to hook you up with somebody who can better meet your needs. So definitely investigate, because I'm getting a question like, I've been told that to get the Emdr certification, I have to do a video and a transcript. Some programs require that if they're going to sign off on your certification. But I know, for example, we don't, although we do leave it up to the discretion of our consultants to ask for one if they feel they need to do a better vetting on your skills. So if you feel you're being met with rigidity about any of these things, wherever you're at, just know that you can probably ask elsewhere. So before we start going in more to, but I think this is also another good transitory question. I got a question coming through here about modifications. So when you're working with LGBT folks, specifically trans folks, because I think all of us as trainers, as consultants, have a lot of strong feelings about stick to the script, learn what you're supposed to learn. And something that I teach on that is you have to learn the rules so that you can break them elegantly when you need to. And when you work with the kind of folks we're talking about, you will need to either break the rules, modify, or just have a wider understanding, right, of who you're working with. So I think there is some interest to know, what are some of the modifications? What are some of the most used applications, interpretations of standard EMDR that folks may need to know about if they are going to work with LGBTQ plus clients? So whoever wants to take that first, just go ahead and unmute.
I would just say, like any other cultural humility, asking a lot, excuse me, asking your client what language resonates with you. What are the things that you're needing and wanting from me? And then really just doing your own work. That's the biggest modification I can say. Even if you are LGBTQ, doesn't mean that you know what everyone else's experiences are like. So creating a lot of, as much as, I hate this word, but safety as you can, to be able to hear that person's experience, to be able to know what language resonates with them and what doesn't. And then oftentimes, as a spiritual part of it, I will invite people to bring in ancestors or even role models. Not everyone has family that's safe. Not everyone has experienced someone, who that they can trust in their life. And so when that's the case, I'll say, bring in Audre Lorde, Oscar Wilde. Who are the people that you've looked up to? And how can we make this a space where that you're seen and heard? I think that's one of the things that I really try to stress.
Love that, Roshni.
Roshni, I absolutely agree with that. And I do think that therapist humility is really a really important starting point. I also think, so because I'm a member of the transgender community, that doesn't mean I know everything about transgender people. So we need to be educated, but we also need to, and we should not be expecting our clients to educate us, but we need to listen to them. And we need to treat them like unique individuals, the human beings that they are, and don't make assumptions. Don't assume that the transgender experience to them or the LGBTQ experience has been traumatic all the way through. So recognize their strengths.
Yeah, I think one of the modifications that I'm mindful of is any body work. Right. So anytime you're going through a body scan, anytime you're moving light through a person's body, is just to be mindful of some of the realities of bodies, which even I think operates in like an ableist capacity. Also, I often find that there's a lot of that gets smuggled in. So I think that's the one that I think, I sometimes will tell my consultees, it only works if it's working for the person who you're with, right? And so to ask those questions and to have that curiosity, I agree, Danielle and Roshni, to say, help me understand like what feels good and what feels grounding. Because if we're doing a ton of body grounding and there's a ton of distress that's held in the body, then we are likely not supporting the person in front of us. And so I think that can use some modification for sure.
I think it's also important to remember the distinction of learning EMDR and then being an EMDR clinician. because I think that ties into when you're learning EMDR. It's such a complex system. It takes a lot of practice to get used to. A lot of my consultees will struggle because I think that anxiety takes over. I have to teach my clients everything I just learned in six days or whatever it might be, and being able to remember, just go slow, take a breath. You're not there to teach them EMDR. They're not going to be doing EMDR. You're providing EMDR. And one of the pieces that I think where a lot of modification can be is really in our resourcing. I think being able to pull in and really slow down that process and say, what are you doing to take care of yourself? And I love to go into the nit and the gritty of like, what are the good stuff and what are the not good stuff? If you're running 5 miles, if you're drinking a keg of beer every night, like I just want to know because my job here in to be non-judgmental, but so that way I can assess and I can see what are your needs, what can we do with resourcing before we get into the reprocessing to make sure that you're prepared, you're secure, and as we continue this work, it's done in an appropriate and stabilized process. So I really love the resourcing, focusing on that. I don't know if that's so much a modification, but I know when I originally learned EMDR, that was something that I didn't get. It was sort of the message was you don't really need to do a lot of resourcing because the reprocessing is going to take care of it, which to me I think is the complete opposite of being trauma informed, because people come in with so much. We want to make sure they're feeling comfortable when we're going into this heavy work.
So I few comments. I think the thing that's I think creates the most foundation and basis for responsiveness is being mindful and following the client. And so being humble enough to be able to say, I don't know, and to check in, to really follow the client. And you can do that. My somatic training has certainly helped me in that regard, to really follow the client. I have in my training a statement that says, to my trainees, that EMDR was developed in dominant culture. And if there are things that don't fit for you, I am open to hear and have a discussion about that. It's not required. And I want to be careful to not sort of, pull out people and say, I think you're diverse. You want to tell me, blah, blah, but to give the invitation. And I think Jamie and I, when we first connected, part of that was around Jamie making a statement to the EMDR community about diversity and having little response. And part of my response to that is, please, EMDR community, do not put a flag out. Do not say you're all welcome and diverse is welcome unless you really mean that, unless you're going to create an environment of acceptance and appreciation and celebration. And so I begin my trainings with a very strong statement that I will not tolerate any kind of oppression or discrimination of any kind towards any part of the diversity of humanity. And so I make that statement very, very clear, and that gets around. So, and I think we need forums to have this discussion, as we've all talked about, in Emdr at the conference level, to start hearing our voices, so that we can talk about things like you said, Jamie, about the depth of what a negative cognition might go to the individuals in the diversity of our community. It's not just I'm damaged or I'm the child of the day. Like these are very deep, and we need dominant culture and to hear us without it being, that we've done some RCT and so on and so on. We need you to hear our voices. And so, don't put your statements of acceptance out there unless you really, really mean it, because you're going to harm people. And that could be that could break the back of somebody that's had years of pain and discrimination and oppression. And you need to listen and you need to be open. And we've all identified that we're still learning. So the other day in one of my trainings, I said, does anybody have any ideas of how I can language different the word mother? And they immediately said, how about life giver? I said, oh, that's fantastic. I like that. So that I could open up the language around gender. And so I'm very careful in the protocols and the writing that I put out, that I'm not using pronouns of he and she, that I'm opening up that language and consistently learning myself, because I'm not immersed all the time in the academic community or in this community or that about various things. So that openness, but please, I ask, don't put the flags out there, and don't say you're accepting if you really aren't.
And we're going to kick this up a notch here momentarily. To that, I will add, and Sue knows this from an article I wrote that we really connected on, which is there is a definite difference between being accepting and being affirming. And this happens in church all the time. And unfortunately, I see it happen amongst EMDR therapists too. This idea that, well, we accept everyone here. If they're defining acceptance as, you know, you're welcome, you can come in, you're all God's children, et cetera, but we're not going to really celebrate and let you be who you really are here. There's one of my favorite memes out there, which is go where you're celebrated, not where you're tolerated. And I know I personally could tell the difference at this point, where it's like, oh, you know, it's nice to have you here, versus, oh, we want the fullness of you here. Okay, so here's the uptick. And I just want to preface this part of the webinar and the conversation by saying the opinions and it's not just opinions, it's lived experiences. The lived experiences of this panel are purely the lived experiences of the people giving them. Yet I feel that a big reason I wanted to do this panel is to invite other EMDR therapists into hearing this experience. So my question is, my friends, how do you really feel around other EMDR therapists? Take a moment to marinate in that a little bit.
What they would call the tea.
Go ahead, Lisa. Go.
What's the tea? I don't really have an answer yet. I just think it's great. I think it's such a great question. Well, yeah, maybe I'll have a quick answer and then I'll tap out and be more thoughtful about it. But I think sometimes I really struggle in the profession and the community with this energy around expert, like this energy around I'm an expert in that, because I think expertise is a thing I hold a lot of value around. Specialization, you put a lot of energy into a place in your work and in your community, but I often think that sometimes in these larger, you know, when I've gone to the conferences, when I've been in these kind of mixed communities of EMDR therapists, this expert language, I think, smuggled in a lot of stalled, like, we're done learning, we're done hearing a different perspective, we're done honoring that someone who is younger clinically or chronologically can come into this space with new insight or awareness or something to share and give. And I think, you know, some of my experiences going to these conferences for years and years and years, some of which has been very valuable to me, but some of which I've seen the exact same material for a decade, right? Let me be clear, the exact same material. And so in my head, I think to myself, I'm struggling with holding this person as being an expert if I'm not seeing new curiosity, because I think learning and curiosity and growth and newness, you know, and so I really struggle with some of those absolute labels and some of those absolute pedestals. And I think I think I know why we do it. Do you know what I mean? And I think there's a lot of this medical model that's quite dangerous about hierarchy and, you know, how people feel honored for the work that they've done and the dedication that they've put in. I just wish there was a different way for us to honor that work, as opposed to like having that be the voice and then everything else needing to kind of stack up behind it. I think has felt a bit difficult to me just as a person who doesn't often see myself represented in that panel of experts. Do you know? And so I'm curious, like, well, how are we having those discussions then if there's none of me in that room or, you know, around that table? And, you know, they always say if you're not invited to dinner, you're on the menu, kind of thing. And so I just think, you know, I think that's where I struggle most with some of what feels kind of like archaic about, you know, the larger community occasionally.
And my quick interjection or response to that is, yes, I believe at these conferences we have to have more panels like this, where lived experience is valued as a legitimate tool of inquiry. And if anybody on the conference selection committee is listening right now, that's why I think y'all need to have us this year, right? To speak our experiences. So who else? How do you really feel around other EMDR therapists?
also, I have some amazing EMDR therapist friends. So like, I feel like they're represented. I love meeting different EMDR therapists. I love, kind of like what Lisa's saying. I love people who love what they do. And I think when you're in this field, you can tell it right away. Do you love your job? Do you love EMDR? And then I think that there's that organic flow. Because then you really go into, your different trainings, the specializations, the things that kind of like our discussion here. And I think, with my friends and colleagues, it also helps me because I'm in private practice knowing, hey, this other person specializes in this, or they've had more experience in this. And I'll say, especially within ICM, knowing that I can reach out to anyone at any time. And I've always been received with open arms. And how can we do this? I don't know. There's that network. Now, on the other side, one of the things that I see a lot, kind of going along with what Lisa was saying, is I see in some experiences, there's a lot of abuse in the EMDR training and a lot of control, which concerns me. Of this is the only way to do it. There's no stipulation from this. There's no variation. If you don't do this, if you don't do it the way I am teaching you, then you're going to hurt someone. And growing up, talking about like religious beliefs and stuff, is that just re-traumatizes me of hearing that, because it's not trauma informed, it's not compassionate, it's not meeting the clinician, the trainee, or the client anywhere where they're at. And it's that when I sense that rigidity and that control, it's big red flags for me. And I think, I'll go out on the, being able to remain humble. I think when we get into that ego ball, that game, it's unnecessary. We don't have to be competitive. We're a community. We're trying to do the same thing. But I think kind of like what Lisa's saying is like some of that old stuff of like, I have this title and I'm better than this. And it's like, I don't want that. And I think clinicians see that. I think I think of graduate students who see that, who are, new to the field. I think clients see that, and I think it's unnecessary.
Thank you, Patrick.
I can speak if.
Yeah, go ahead.
So I have mixed feelings about this. I've had some really wonderful experiences in the EMDR community, a very loving, warm, caring people. I have to say that when I met Jamie and when I've met others, there was still that sense of relief. Oh, thank God, here's somebody in my community and that understands my diversity, that like when I've gone on trips of women from my community and just been able to drop the censoring and be free and not have to think now is can I say this or can I, so there's still that exists. And I remember being at an EMDR conference and being with somebody that was very prominent in the community that I, had a relationship with in terms of a professional and friend relationship with, that all of a sudden did one of those microaggressions, like, I accept your lifestyle. And it just hit me. I was really shocked. I just thought, what? I wouldn't have guessed that she was of that mindset. And it really was upsetting to me. And so that's tiring. And I frankly was, really shocked. And it's also tiring, the heterosexual focus that, just like language, not being open, but the heterosexual. And I can't tell you the number of times that I've, said to a therapist and then I've had to move on because I've said to them, so do you understand my community and that couples, there are different dynamics and important things about couples therapy in my community? And I can't tell you the number of times they've said, oh no, it's all the same. You can read this book or that thing, it's all, the basis is all the same. Don't worry about that. And I just move on. But so that's tiring. And yes, I have met some really beautiful, lovely people that I feel completely free and open with. I remember, I have many stories like that as well that are very beautiful, but it's just every once in a while you start to feel comfortable and then poof, there's one of those and you're like, oh no, really? Ouch. We're still that way. I do have to say, I appreciate it, and it was very hard on us in Canada as well, the last 4 years. That was, I think, really triggering and traumatizing to us as well. The nice thing about being in Canada is it's illegal as a therapist to support discrimination and oppression of our community. And so you could lose your license. And so I do really appreciate that in Canada, but we've really felt your pain, and it's been very hard on us as well, watching what happened and to hear that rise in oppression and discrimination. And so, yeah.
Thank you, Sue. And Danielle, I saw you had unmuted, and then Roshni. How do you really feel around other EMDR therapists?
Well, the EMDR therapists I know in my area, I love. I've gotten a ton of support. I think what happens is we find like-minded people, and we get support from them, and we associate it. So there is such a wealth of support among some people. What disturbs me, so my interesting piece is the first time I came out as Danielle was at the Emdr convention in 2019. So board members, I interacted great with board members, and actually they had just recently passed their measure on sexual orientation change efforts, and I know that they were really proactively trying to be inclusive, and I know some of them, and I believe they are following through with that. But I think that there's other elements that are less inclusive, that are more conservative, that were trained when having, quote, gender identity disorder, which I don't use, was a disorder. And there were some who advocated sexual orientation change efforts and the use of EMDR. Those people are silent now, but I think there probably were people that supported that and attended their trainings that may have held some of those same beliefs. So I'm a little nervous, and I think when you're a member of an oppressed minority or a minority, you're pretty sensitive to reactions. You can read people pretty good. So I know who's supportive, but I also know right away who's not so supportive. And I do encounter that sometimes. And I think it's something we all people need to work on.
So well said, Danielle. And Roshni. And then I'm going to answer the question.
Yeah, I think for me, for the most part, I've had fantastic experiences. I love that Jamie holds that line, like, you can't bring hate into Institute of Creative Mindfulness. This is what we stand up for. This is, the foundation of the work that we do. So I will just say, like, my pet peeve is like saying that you are LGBTQ affirmative, using the rainbow, showing that you're this quote unquote safe space. Whereas, have you ever taken a training? Do you know how to use appropriate language? Your client is not there to educate you on that. Your client is there to be themselves and allow that to happen. And so I think the biggest microaggression that continues on is the invisibility, just feeling like our voice is not important, not seeing as many folks, obviously, other than the folks here, out there talking about this stuff. Unless it's abundantly clear that you're an ally and you've done the work and checked your privilege, there's no way that you could even begin to know what this feels like. And so doing your work is an ongoing thing. It's something that I can probably say without a doubt that all of us are continuing to do. As Danielle had said earlier, because I'm transgender doesn't mean I know everything about it. So I think that, really hearing our experiences, listening to, what we as queer therapists have dealt with in working with our clients, what we bring to the table, I think that that's really important. And what kills me over and over is hearing these horrible experiences when clients come in and say, this homophobic statement was made to me, this racist comment was made to me, and, having them feel afraid to go back into EMDR because they weren't resourced well enough or prepped. And then when I do EMDR, having them tell me, that's not what I did before. This is completely different. I mean, that's what breaks my heart, is like, just sticking to what is actually helping clients to heal, and really taking into account their complete experience and recognizing that you just may not know what that's like, and that's okay. You don't have to overcompensate or pretend. Do the work. There's trainings out there. There's, all kinds of stuff that you can tap into.
Thank you. Lisa, go.
I just because Roshni just spoke to my whole heart. Like, I think when I was thinking about it, I was hearing everyone say, like, of course I have these wonderful relationships with EMDR therapists, but the larger community, just when you were speaking, it's like, you'll never get the answer if you don't ask the question. Yeah. And I think there's a lot of assuming that happens in these communities, that everyone's well-intentioned and that's enough. And then I agree with you, right? You get these clients that come to you and they've had these really damaging experiences of EMDR therapy, which now I'm a member of that community, right? And I don't hear a lot of honest conversation, right? There aren't a lot of points of accountability where folks, to your point, Danielle, like, we're all the people that were co-signing this very harmful perspective. Like, those folks didn't just disappear or quit practicing. They're still in these spaces. They're still at these conferences. They're still holding those perspectives. And so I think, like, how can we have a conversation that encourages vulnerability like this? Like, you have to ask the question, because I have had experiences, and maybe we all have had them in this community, that feel diminishing or microaggressive. And it's like, you got to ask people those questions. It's not enough for us all to be like nice people who are helpers, that kind of language that I think absolves a lot of transgressions for people.
Thank you, Lisa. So I will speak to mine. How do I feel around other EMDR therapists? I mean, I echo what so many people said. In general, some of my best friends, my dearest connections, are EMDR therapists. But I will say, one of the unexpected fruits of having grown up in so much conservative religion is I can have an appropriate, I believe it's adaptive at this point, watchdog mode around, wait, this is feeling a little too fundamentalist. It's one of the reasons I kind of cut myself off from the EMDR community for 5 years. From 2010 up till about 2015, I kind of wanted nothing to do with the conference and being, I didn't even, pursue being a trainer till after that. But I'm glad we're talking about microaggressions, and because the thing with being a bisexual woman is a lot of people don't know who they're talking to in professional context, because I have been married to 2 men. That's just been part of my journey. And I had this experience in around, it was like 2014, 2015, when I was first kind of dipping my toes back into the community. I was out to a lot of people. In fact, one of the first people I came out to professionally was another EMDR leader. But I still wasn't out fully until about 2015. And I remember in 2014 being at an EMDR event that I was invited to speak at as a therapist. And I was still married to my second husband at the time. And I also, because I grew up in so much church, I could hang in there and I could talk theology. I definitely can, right? And so when this one individual was speaking to me, knowing I was married, knowing I had a background in church, then all of a sudden I started hearing just some of the snide comments about the lifestyle, as Sue kind of pointed to, and this idea that, the gays are getting everything they want in the name of political correctness. And, I heard this from an EMDR therapist and trainer, right? And it immediately set this like, and now I probably would have responded differently. But at the time, still not being fully out, it was very much like okay, smile and nod, smile and nod. But I will say it was a transformative experience in making me realize why I had to be out in this community, because there's just so much of that kind of stuff happening. And we will speak here in a minute to specifically how do we, as LGBTQ plus therapists, work with this issue of religious EMDR therapists who believe that they want their voices to be heard too. I mean, I have a lot of strong opinions theologically on that. And I think as a community, this is also, a conversation that we have to have, because, and I'm glad Danielle brought up the whole, and this is a good step in the right direction. Totally, that Emdr put in the sexual orientation change efforts policy, because I think it really shows that as an institution, this will not be tolerated. Yet, as all of us know, because that 2019 conference Danielle referenced coming out as, that was picketed by some folks who are kind of doing this rebranded conversion therapy thing and using some EMDR or EMDR related methods towards it. So there is still a lot of this hatred and misunderstanding that's quite alive and well in our community. And how I hear EMDR therapists justify it a lot, and this pisses me off, I have strong feelings about this, clearly, is, well, the key of EMDR is just staying out of the way. And if my client wants to work on unwanted same-sex attraction, who am I to, tell them what they could work on or not? Or if we're going with that and it's something about their faith and their identity clashing, who am I to interfere? And so there's still those kind of comments being made amongst EMDR therapists and even EMDR consultants and trainers. So this issue is far from resolved. So yes, just any responses from the panel about that connected to microaggressions or anything that I may have just put out there. Roshni.
I think we have a responsibility to acknowledge systematic oppression.
Yes.
And to recognize that as clinicians, we cannot be reinforcing that. That is so traumatic and not okay. And it is causing harm. And so, I think it's okay to call people out who are doing that. And it's also not okay to have the client where you're in a position of power telling them, yeah, you're right. Let's change that. Because frankly, it is so damaging, so harmful, and just upsetting, obviously. And it really angers me that these kinds of discussions are still taking place. And what I often hear is that this person went to therapy, had this experience, reinforced that, and then they stopped going to therapy. And what ended up happening to them, where were they able to get support? I often get referrals, and if I'm full, I'll say, please call me back. I had a trans guy crying on the phone to me the other day because he was like, yeah, there's no trans therapists who take my insurance. So I'm like, call me back. We're going to figure something out. And it's really so disheartening to know that someone who's coming to you in a vulnerable place, needing support, that you're basically exploiting them and reinforcing horrible oppression that's gone on for way too long.
Well, I get pretty angry too about this stuff. My real concern is that if you want to double somebody's risk of suicide, which is what the stats show, just do it. And how on earth could you be a mental health clinician and be ethical and engage in such a practice? I think it's that simple. And what infuriates me is that most of the youth in our country still can be subjected to conversion therapy against their will. And, when I do trainings to people, I have them, because you can look it up on Wikipedia, it's pretty accurate. And people are astounded because I live in a blue state where it's outlawed for both religious leaders and therapists, but most jurisdictions are not that case. So it just really, my feeling is that there's just not enough. The research goes back, before 2010, there's research about how harmful this is. But people choose not to listen to that and ignore science.
Mm-hmm. And Danielle, to that point about conversion therapy or reparative therapy, and I know we all share our stories like, yay, it's been outlawed in this area, it's been outlawed in this area. It has been so rebranded so many places, called other things, or this justification of, I just stay out of the way. When I think this is an area of, if you're reinforcing oppression, my skin in the game is if you're reinforcing religious oppression, that's still harmful. and you're staying out of the way and not saying anything could be doing more harm than good.
You know, if I can just share, I have a little bit different experience. If I'll go on the vulnerability ledge here of just kind of reminding that, you know, I agree with everything that you're saying, but I can say in my experience that sometimes it's frightening to be the person who has to challenge that. And I was in a staff meeting a few years ago, and a team filled with educated, you know, committed professional people. And, you know, we were talking about a group for LGBT, and the person leading the meeting says, "Oh, you mean LGBT LMNOP? Isn't that what they call themselves now?" And I just remember like all of the air in my body just left. And it was that moment because I was new. It was terrifying of like, do I out myself? Because if I do, how do I advocate? And it was one of the most painful moments because I didn't say anything. And that was a mistake. And just like you're saying, Jamie, you would say something different. But I think, you know, just kind of throwing it out there, when we're having those conversations, just reminding people, it doesn't mean it's easy. It's scary. It's terrifying. There's just, you know, all of the violence that we see all of the time, all of the threats against our community, that's in our mind 24/7. So people think, you know, when you're advocating, when you're standing up, whether it's for one of us or a client or someone else, it's terrifying. You are putting yourself out there. And I admire people who do that, and I admire people who can advocate. And I hope that I can represent better than I did in the past, because I know in myself that it was scary. And I think just being able to bring that in of like, none of this is easy. None of this is easy. And but if what I've learned, kind of like what, you know, with Danielle and everyone else's experiences, if I don't stand up and say something, this shit's going to continue. If I'm not the person who can stand up for the person who maybe doesn't have the privilege that I do, or doesn't have the whatever that they need, if I'm not fighting for them, whether it's just as a person or as a therapist or as an EMDR therapist, I got some work to do.
Mm-hmm. Yeah.
I think it's just hard. I just think that needs to be out there too.
Thank you for highlighting that part of it. And I just had a huge point of relation with you. Like when that first happened, or it was like, whew, freeze response.
Yes.
Roshni.
If you don't have sympathy, you just don't belong in this field. If you think that everything comes from what you see, you know, this is just not the field for you. I think that psychology has been very, very harmful to our communities, to folks of color, queer folks, and it's still happening. And it's important for us to acknowledge it and call it out and look at the fact that this was not made for us. We are paving our own path. And I think that's often why the feeling of imposter syndrome is there, is because, you know, this wasn't made for us. We're having to adjust things to be able to meet our communities halfway, to meet anyone halfway. And I think that unfortunately is still a very, very huge problem.
Patrick, I just wanted to add that, you know, my anger turned to sadness when you were telling your narrative, because this is what we all face. And, you know, we're all doing our best. And sometimes it just seems so overpowering. And I think we've all been in meetings where it didn't go that well. And it's, am I going to be the only one? Are there going to be allies? Do I need an ally? Can I do it? I feel that too. And I really appreciate you sharing what you did.
Thank you, Danielle. So Lisa, go ahead.
Oh, thanks, Jamie. You know, I think also when I'm hearing this, you know, one, I always say to folks, you know, I'll do these trainings and I'll say, this is not an opinion of mine. This is in your code of ethics. So if you're a competent professional, I want you to go and reference that space, because I certainly hold opinions and they guide my life. But this is not an opinion, right? This is an expectation, a basic expectation, so that we can perpetuate a space of like equality, whatever, you know, that language means. But I also think when I'm hearing Danielle and Patrick speak, like, you know, I'm always like, there is work to be done in the house. Also, you know, I've had a boss who was queer identified, who I think often did not identify me as a member of a queer community, but would do things like when she walked into a room, when she spoke to me, she would rap songs at me, which is wildly microaggressive. She would start singing rap songs to me. And so here we are within this queer space that's supposed to be safe and that's supposed to be liberal, but you're engaging in this really microaggressive behavior. And, whether you're doing it to my white colleagues or not, it doesn't matter because the impact is different for me, right? And so that's a space where even thinking about, Patrick, can I be confrontational, but can I also call people in? And I didn't have a great relationship with this person, so it wasn't, we were best friends, but even that space where none of my colleagues in that environment, who I trust immensely, were able to say, hey, that's teetering on something that's really damaging and dangerous, and so even when we think about how we're showing up in these professional environments and, are we creating a space where identity has become pathologized and reinforcing it? I just think it's so dangerous, and it's dangerous to let that up even in communities that we share some identities with.
Yeah. Thank you, Lisa. And a point that's kind of summarizing for me in this area, and then I want to go into the next question, is what I'm hearing, and part of this is reflecting on my own experience and seeing some of the comments in the chat, is when you're new in this field and you hear your first comments like that at a meeting, it can, of course, bring up a lot of terror around, oh my gosh, if I speak up, am I going to get fired? Am I going to get punished? Am I going to get, another onslaught of microaggressions and the workplace being very uncomfortable? And I think there's obviously, when I was new in this field, and not just about sexuality, but obviously about mental health stigma and addiction stigma as well, there's a lot of things I sat on. But now, as an older person in this field who does have a great deal of power and privilege, especially in EMDR and trauma circles, it's my responsibility to be speaking up now, because I'm no longer really driven by a lot of those old fear messages, as a new person. And so I want to be clear that if you are new, if you are in a situation where you're if I speak up, am I going to be unsafe in my work setting? I do get it. And just like we don't force people out of the closet, I also don't believe we should force people into advocacy, other than to say right now, we hear you, and keep noticing how those experiences may be bothering you. And as you grow as a professional, to start asking, where can I speak up? Even if it's in small ways. Where is the time? Where is the space? Because something I've learned about privilege in a lot of my own reflections is it's not an inherently bad thing to have privilege. How are you using your privilege? How are you using it? And I think, everybody who's on this panel today is using their position and their voice and their strength to be able to call out, a lot of what needs called out here. And we're not going to solve the world in the remaining half hour that we have, but I think we've at least started a good dialogue here. So here's my next question. A lot of this is I would like some consultation from my friends on this, because I can even struggle with how to negotiate this, manage it. But it is an issue in the EMDR community. And that is, like Lisa has said, at ICM, we really try to create this, hate is not welcome here. And I inevitably get conservative religious people who are yes, but you clearly hate people who are conservative and religious. And I've always felt that, no, I do not hate you in your practicing of religion, that it's not inherently about being religious. But I do believe, and I've studied the theology enough to know, you can still be a practicing Christian or a practicing Orthodox Jew or a practicing Muslim, and you do not have to discriminate against queer folks, LGBT folks, trans folks, to practice your religion, right? But inevitably, whenever I have these kind of dialogues, I get the pushback that, people just want to practice their faith. People just want to practice their faith. And even in a lot of the groups, I'll see requests for Christian EMDR therapist, and that kind of being used as an identifier. And I'm bringing this up as a point of conversation because we do have a lot of therapists, even therapists who come through our trainings, who will say, my Christian faith is of utmost importance to me, and according to that, everything you're advocating for is unbiblical. And then I send them to Mark Sandlin's article and interview, which you can access also here on ICM. I had a chance to interview him this week. Because I am in a position where I've come from that world and I know enough theology where I do take up Christian therapists on that. And in some contexts, I will say, you know, I'm not here to debate theology with you because this is a clinical training. However, you have a responsibility to know how your theology impacts the way you show up for clients. Because Lisa's so right. The codes of ethics are on our side. They really are, as queer folks. And it becomes up to you, if you are feeling that your faith is preventing you from that, to do that work. And I'm also remembering, you know, an experience I had where I was asked to come in-house to do an EMDR training for a Christian identified agency, right? And something I said to them as we were even organizing the training is, I'm a queer person, and it's right in my bio that, like, I won an LGBT advocacy award. I'm not taking that out. And they're like, okay, we don't want you to. Like, we want you to kind of bridge the gap because you know how religious people think. And that was why I ultimately agreed to do the training there, was they weren't expecting me to alter who I was in coming in and doing the training. So from that mess, if you could make out the essential question here is, what role is religion and the impact of religion on a lot of our therapists who still practice EMDR and come to our trainings? How do we unpack this, especially as advocates? Go with that.
Well, I think part of the problem is the interpretation of religion, right? I mean, currently we're dealing with most religions being the interpretation of various people for various political reasons, having rewritten religious texts. So I like to remind people that when we go to the heart of it, all religions are about love. All religions are like, love thy neighbor, be a good person, don't kill anyone, don't do anything crappy, don't harm people. So if you're actually operating off of that, cool. Also, you know, the interpretations, like whenever you're coming to a place where you're superior to someone else, you're doing a great disservice to yourself more than anything. And so I think the way that it is like, I'm a very spiritual person. I've been exposed to several different religions. I was lucky to grow up in the way that my parents were very new agey, and they, you know, showed us a lot of different philosophies, religions, meditation, all that stuff. And so I was able to come up with this very accepting, very open, like, let's have these conversations. Let's talk about, you know, the foundation of this. And I think if you bring rigidity to religion in terms of the way that you feel other people need to act, that's where the problem starts, right? And with therapy, as therapists, we're not coming in to rescue you and change you and make you anything. If you have that and you're bringing that in, you're not doing therapy. You're doing a great disservice. So if we're looking at it from the perspective of, yes, I have this belief and it guides my work, then really what should be at the underlying belief, in my opinion, is to be here to be a good person, help others. And if that's not your interpretation, I'm happy to sit and talk with you for hours to get down to the point where you can see the point that all you can control is yourself. And that is something very key that we teach our clients in therapy, right? Like, unfortunately, we can't change the environment around you, although we will work to. And so I would say the same thing to therapists, like, whatever you're bringing in, this is not about you, right? And of course you're looking at it from that lens, but to acknowledge that everyone has a different experience and perspective is, I think, just extremely fundamental.
Yeah.
I think as you hear our voices, perhaps those who are listening may be like-minded anyways. That's why they're listening. Hopefully there are some others who've taken the opportunity to listen who may not be. And I hope you'll hear our experiences, that that discrimination and hatred and oppression can kill. We're not talking about, you know, just doing a little harm here. You can, through your messages of hatred, create death by people just, it's the last time they've heard it and they can't sustain the oppression and hatred that they've experienced in their lives. We are talking about very deep harm that you can create. And that is not okay in any professional field. It's not okay with the Charter of Rights. It's not okay with your code of ethics. And so if you cannot do this work without that hatred, then you need to stay away from our community. Just refer them to somebody else who can hold the space for them. If you can't have the conversation, if you can't listen. And I agree what we were saying before. It's not always easy for those of us in certain circumstances or our friends and colleagues to be able to stand up and speak against this. They may just get quiet and silent and disappear, and that's not okay. We've all had that experience. And, you know, as Jamie said, as we come into places of power or privilege, we try and use that to make changes. But there are still forums where that's very, very difficult. I worked in corrections and I heard terminology that was terrible, and had, you know, another colleague come to me secretly and say, will you speak against what was said in that meeting? They used the word tranny and it was horrible. And I said, they will not hear my voice as a woman. They will not hear my voice. And so that still happens to us. And so I just ask that you stay. If you cannot listen and you cannot entertain being affirming and caring and loving with our community, then please just stay away, because you can create great harm.
Yeah, I just feel like I just want to take a breath. Like, that's such a powerful thing to say to someone, right? Like, just kind of stay away from us then. Like, the stakes are high, right? This is not an opinion. This is the fact. And I think, unfortunately, most of us, I guess, have had a personal impact with something, you know, around that, the kind of harm and danger of it. So, because I just think, you know, nothing is objective in the whole wide world. So even when people say a Christian counselor, like, that means a vast amount of things. You know, I was raised in a Catholic faith, but I was raised in a class in a very poor, impoverished way in Catholicism. And the message and the focus of my Catholic church was much different than as I got older and I was going to churches that were more affluent or, you know, more whatever it is. And so even just thinking about my own religious upbringing and how nuanced that is, depending on where I heard the message, where I was in my own life, where I was in a community, you know, this idea that somehow if we say Christian, that it universally applies and is effective and is helpful and resonates with everyone, I think there's a little bit of something in that feels obtuse, right? Where I would say that even that it's not meeting everyone's need to say it, but like, what lane are you in? Right? I don't think this should be a difficult question about capacity. Are you in a religious capacity right now? Did someone come to you in a space where they were expecting to hear faith-based feedback? Or did they come to you and they were asking for this other, like, formal professional identity? And so sometimes I think to myself, again, like, I have tons of beliefs and values and I use them to guide my own life. But when I am in this space, right, it's really not the thing that anyone's asking me to do. I think, to Roshni's point, like, that's not what anyone's asking me for. And I sometimes think to myself, from a position of being, you know, a Black queer woman, if you hold those discriminatory values, then can you be held accountable to just saying it then? Because that's what I want to see on your website then. I want you to write on your website that you are homophobic and that you are racist and that you are, I want you to put it, because I don't want you to keep profiting, right? It takes my time and energy then to come into your office and discover that in a very painful way on my own. And so part of me even feels like, listen, I don't even want to get into the debate with you, but can you be held accountable for where your beliefs take you so that folks can be informed in their decision of whether or not they're going to consume your hatred or not? You know, like, it's too much work for me to do it. Can you just tell me then that you aren't going to treat me with dignity and respect? Because I'll just take my money somewhere else and my time. Oh, I'm so frustrated. Girl.
Preach.
I think your question is really powerful, Jamie. And the first thing that I thought of was, it's like, I don't hate religion. Like you're saying, like, you and I have talked about this. Like, I love it. I love different religions. I love it. But what I don't accept is the violence. and everything, like what Sue and Lisa are saying, the last couple of years, the violence I've seen, there was a protest in some state where people were saying it had nothing to do with the LGBT community, but then there were protesters who were holding signs say burn the gays. And my mind went to, it takes that breath away. So when people, one of the comments, and I don't want to go down the rabbit hole, but the whole thing of like, why do you have to come out? Why do you constantly have to talk about it? Why is it always in our face? You stole the rainbow. Like, like it's all of this nonsense. I'm like, we're not, get some Skittles, get over it, do the work, face your fear. And my question, I kind of pull in a little bit from my couples training of what is the need? What do you think I'm trying to take away from you? I don't want anything from you. I want to be safe. I want everyone on this panel to be safe. I want you to be able to walk down the street with your partner and be safe. I want you to be able to kiss your child and not be accused of something. I want you to be able to hold hands in public. I want you safety. I think of kids when I was growing up, I remember hearing the story of Matthew Shepard. And one of the traumatic things in my brain was because he and I were both white, we both came from similar areas. I thought, talk about a negative cognition. If I come out, I'm going to be killed like him. Right? So talking about fear, talking about that paranoia, that because it's real, but then, how do you keep yourself safe? How do you advocate? And going back to what you're saying, it's not about taking away your religion, but you're not going to bullshit me and protect that, because that is violence and that's not true. Just like Lisa's saying, is be authentic, own it, but you're not going to take away my safety anymore. And I just think of all the young kids, of all the, as we all know, the at-risk youth who get all of the messages in our very complicated worlds, and just wanting them to be safe, wanting them to be able to be kids, wanting them to be able to fall in love. Like when I see nowadays, cartoons where it's a same-sex couple and they're in love, or like I have two mommies, those books, it gives me hope. It also just brings up pain of, man, I didn't get that.
Yeah.
But I don't think we want to take anything away. We just want that safety.
Right. And a sub question we're getting on this, and I want to bat this especially to Danielle. So Danielle, if you have any thoughts on what we're saying, go there. But one of the questions we're getting is, especially with trans youth, what would the panel recommend for working with parents? And the resistance is the parents. And I think this goes not just to trans youth, but to any youth who are LGBT identified. And I know in some of the faith-based agencies I've been talking about, that's the struggle, that the therapists are actually on the side of the kids.
Yeah.
But the parents can feel like, change them, fix them.
Well, let me just add, as far as the last piece, and I'll make it really short, is that because there's a conservative religious movement in this country and others, doesn't mean that I have to give up my spiritual beliefs. Right. And I consider myself a person of faith, and I interact with people from that perspective. Oh, and I think we can have dialogues that way. And we need to have respect, because people really do have a right to their beliefs. It's what we do with those beliefs, which is really, the factor, and that's the bone of contention. But I can respect other people that bring in a wide variety of beliefs. But it's when we get into actions and we get into hurtful actions. I think with children, with youth, this is my segue, is that this is particularly tricky. One of the things that I do that I point out to parents is, the research showing what the outcomes are. You toss your 15-year or 16-year-old child out of the home because of your faith. What life does this give to your child? Like we all know firsthand, or most of us know firsthand, what sort of life that gives to that kid. It really takes away hope. More often than not, they end up in the sex trades. It becomes a self-fulfilling prophecy. So I don't say that all in the 2-minute blurb that I just did, but I engage people in the discussion, and then encourage them to consider consequences, to consider that there may be other alternatives. There may be ways to get through this family crisis. without pressing the eject button.
Yeah. Any other just lingering comments? Because I have another good question I want to get to here about the youth parent struggle. Lisa.
I do. My only thought is, so I don't see very many small children. It's not a place where I think I'm best suited, but I see quite a few adolescents and teens and kind of really early adults. And I think one of the things that I'm careful about is like, can I position myself as the therapist to create a lot of consent, right, between that child and their parent? And so often, with teens, they're asking the question about like, well, what are you disclosing to my parent? And I make it aggressively clear about what you're asking me to disclose to you and what you're not, so that the kid then gets to engage in really consent-driven discussion, right? So we can just not use any pronoun. We cannot use any name. We can operate in this space where you get to have support and healing, and you don't necessarily need to do that in this really kind of pushed, forced vulnerability of coming out to me, which then puts this additional burden on your relationship. And so I think sometimes for parents, for instance, I'll tell parents, so I want you to hear me say that I will talk to you about risky sex, but not sex, right? But you're asking me risky sex, so sometimes that's a bit of language that I'll share with parents. Like, I want you to be clear about what I perceive as my duty here to talk to you about. And I think sometimes that's getting in front of it a bit and making sure that we're having a lot of consent-driven spaces for these young folks to, and I think EMDR therapy helps with that, right? I don't need you to give me a huge description or to have a bunch of like very specific detail. And I think we can have a little bit of room and movement to model, right, some healthy consent-driven like visibility and movement.
I think, there's some of you may be familiar with the TV series now, The Handmaid's Tale. And I think Margaret Atwood in the early 80s had her finger on the pulse of the difficulty, and that generation after generation, we seem to fight and come back to some really prominent issues that at the core have not shifted. There are some shifts, but we still are coming back to that. And I think we all were awakened 4 years ago in 2016 to the fact that that can go that direction. And when I was writing my will and saying to the lawyer, I want like this portion of money to go to this community, to my community. And she had put in there that she would give discretion to the university. If they couldn't give it to that community, they'd find another way to use it. And I said, no, because this comes back around, and it comes back around in the basic tenets. We still have a long ways to go and fight in many areas around oppression and discrimination. And so we all have a responsibility here.
Jamie, I also recommend, especially with parents, to watch the movie Prayers for Bobby. Mm-hmm. If you haven't watched it, it's one of the most beautiful films, and it talks about religion, it talks about family, it talks about a whole bunch of different things. It's one of the most beautiful films, and just kind of watch that and see, as parents, the power you have. Even if you don't think your kids are listening, they are.
Yeah.
Agreed. That was one of the things I would say a lot when I was working with families more, and I would just say, if you feel like your kids don't listen to you, they're watching every single thing you do. And I think what it comes down to is, echoing what Sue said earlier, this is a life and death situation. Would you like to hear your kid and listen to them, or would you like to attend their funeral? Because it is that serious. It can go there very quickly. And so I think it comes down to absolutely giving as much ability for the kid to be able to say what they're okay sharing, and to involve the parents only in the ways that are okay. I kind of have, some issues. I think there needs to be additional lobbying done around the fact that kids who are queer should not have to have their parents' consent. I know that's something you're supposed to go and you're supposed to seek out the consent, but frankly, there's a lot more elements there. I also really have a problem with all the state lines being like, you can't provide therapy across state lines, or straight lines for that matter. And the problem with that is I have people calling me from everywhere being like, there's one therapist and they're in my town and they're homophobic and there's no one else I feel comfortable with. And I think that's a huge thing that needs to shift, especially for our communities.
Yeah. One personal reflection I want to give in this, like as a youth who grew up in a religious home, but I agree with all of this. And if you feel like you're in this powerless place with not getting through to the parents, never underestimate the importance of the seeds you may be planting. I had some amazing reflections recently on the impact of my third grade teacher, the impact of my high school guidance counselor, in planting these positive cognitions there that you are fine just as you are. And they were life rafts to at least keep me afloat until I was able to piece it all together. There's one question I got here that I do want to answer personally, and then we'll lead to our kind of final wrap up here, although I feel I can keep talking y'all forever and we could do a whole series on this. And here's where I do have a sensitivity, because I did grow up conservative. I did grow up religious. And I remember in graduate school, I was still kind of being decoded from a lot of that hateful rhetoric that I had been asked to subscribe to. But I was also that person in graduate school that was like, wait, have you ever actually met a gay person? And that's where, a lot of my struggle got reconciled. So I do think, especially like as very liberal therapists, we have to be mindful of not overly shaming people who come from conservative culture and religious culture, who ask legitimate questions where they may really have a desire to change, while also holding in the same and the passion of Sue's statement that people are literally dying, and we can take very direct advocacy about that. But I think of like the therapist I would have been had I not been decoded, had I not been challenged. And so I do want to hold sensitivity for this question, which is, as I'm a heterosexual EMDR therapist who's a Christian. My question is, how can we refer LGBT clients without feeling guilty or afraid of being accused of discriminating against this special community? My first thing is, if you are an EMDR therapist who is a Christian, please, 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 as a personal favor to me, watch my interview that I did this week with Pastor Mark Sandlin. It's right here on the ICM page. You can go back a couple days and find it. He offers such theological, what I feel is intelligence, theological context for a lot of the arguments Christians have been spoon-fed around why being LGBT is sinful. And my hope would be, as a therapist, you're at least willing to watch that interview with a little bit of an open mind and an open heart, to realize that a lot of what you think is part of your religion may not be, really may not be. And so that interview is also on the ICM webpage now, the YouTube page. And I would just ask any Christian identified EMDR therapist to watch that. And secondly, I think, because referring is a delicate dance, right? Because on one hand, I'm very pro referral, because if you are out of your league with working with somebody, or you can do real harm with working somebody, you do want to send them out. But we've all heard stories of clients who feel like rejected, right, when they're referred, or can feel. And so I think my personal thing would be to let them know this is an area I'm still working on. And I don't know if I can provide you the best care where you're at right now. That would be my thought. And to really, I don't know if you all agree with this, but to quote a very bad dating line here, it's not you, it's me. I'm still working on this. But before we go to our final question, just another personal share I want to give, very much echoing what Sue has said, and Sue, I was very moved as you shared. I just had like this visceral thing rising up in my body that this is a life or death matter we're talking about here. It's not an issue of, well, clearly we have two different opinions, or no. And something I will put out there as a business owner is, although as a bisexual woman, I have established my business to be something that is queer affirming. In the early days of my business, especially because I'm in Ohio, which is the ultimate swing state that has turned red in recent years, right? I kind of held a lot of this, well, maybe don't be so loud with a lot of what you post because you may alienate some customers. Or kind of what I said, I want to be able to work with the Christian therapist too, to get them to see a different perspective. And as a lot of you know who read my work, then one of my very best friends, Jason, died by suicide in 2019. And he was a gay man who had so much in the way of recovery, 12-step recovery, EMDR therapy. He was the most willing person to go there with a lot of these things we're talking about today. And even one of the final deep conversations we had before he took his life was he never shook what church did to him. He never shook it. And at this point, I'm in a place of, I don't care if I lose trainees. Because this message is loud and we really do need to share it, that it is a life or death matter. So thank you, Sue, so much for highlighting that today.
You know, one thing that really helped me when I was leaving the very conservative church, I happened to come across, I was so thankful to meet this Christian therapist who said to me, because I was really struggling and very suicidal at the time. And my therapist pointed out, I remember her saying to me, so when are you most suicidal? And I think she was trying to get me to understand. And I'd say, well, Sunday afternoon after church. And so this therapist said to me, so what I want you to do, I want you to picture Jesus in whatever church you're in. Just see him and just imagine what's happening. And so when I went back to the church for the last time, I saw Jesus on the pulpit, just standing there looking out at this large congregation, weeping. That's what I felt. He was just weeping because they couldn't hear his ultimate message of love. And so that was really helpful and transformative to me. I mean, I struggled for a while after that. I had to dive into the scriptures and understand there were other interpretations. I had to decode too. And it took me a while to do that. It was so helpful to be in university and to be in the Rainbow Center and to be around other people who understood and to come to really understand that those who couldn't accept me, because I lost my whole community, they were my family. I lost them. After many years of them knowing me, knowing Sue, the 5 minutes when I came out, and then that was over. And that was very, very difficult to lose my community, not just to be rejected for who I was. I came to really understand that it wasn't about me and it wasn't about our community. It was about shaking their foundation that they were hanging on to. And they just could not hold that ambiguity. It questioned everything that they stood on in the entire foundation. That I now take that understanding and compassion when I work with those who hold those beliefs, that I understand I'm shaking their foundation so much. They're in terror about where that will leave them. And I've been there because those 180s that I had, where I was so terrified and it was ambiguous and I didn't know what was happening and questioning and all of that. I hold that compassion for what they're facing in being able to question and shift from very fundamentalist beliefs. And so I took that learning and I spent a lot of time in university teaching. They often ask me to come to social work classes and stuff. And if you would allow me just for a moment to share this picture, this helped me, and I hope it will help many of you, that instead of that line of homosexuality, heterosexuality, bisexuality, one line, you're either this, this, or this. Think of it as many lines. That what is your, how is your feeling sexually towards male, female, non-binary, whatever? Think of it as many things to open up the conversation about it's not just this one name and this one identity, but there is a lot going on here. And if we can open up the conversation about how you might feel sexually towards one person versus physically versus spiritually, emotionally, mentally, maybe if we could open up the conversation that there's a large diversity happening here. It is not so, one specific way. And if we can open up that conversation, perhaps we can start to move towards a more inclusive understanding and affirming of diversity, just in this regard. So I hope that's helpful, and thank you all. It's been really a blessing, and I feel great gratitude for hearing all of you today. That's been the most important thing for me today.
Most definitely. My heart is very warm too. And before we, go into, so you kind of read my mind, asking the final question here, which is like, what if you could kind of leave EMDR therapists, EMDR consultants, EMDR trainers with one message, what would that be? And if you have any additional thoughts on that, you certainly can. Before I formally ask the question, because I know we're at time and some people are logging off, this recording will be available indefinitely right here on the Institute for Creative Mindfulness Facebook page. It'll also be on my YouTube channel, Jamie Marich. We'll link it as well on Institute for Creative Mindfulness under free webinars. And one of the reasons I know I wanted to host this and everybody was on board with this is we want you to share this. We want you to share this with your EMDR communities. And really, I think larger therapeutic communities can benefit from this too. But we've all had some very strong feelings about specifically what's happening in EMDR. So please, please, please pass it along. And I'll also put in the notes all these places where you can connect with the good people on this panel. So yes, the final question is there anything kind of lingering that you want to say to our larger community? Lisa, go for it.
Thanks for letting me pop in first. I actually have a commitment I have to bounce to, but I just wanted to say, and I was really thinking, Sue, when you were talking and Jamie about your question and my general thought about doing this work, that is, I think when done well, is very vulnerable and it's very personal and it's about connection. I have this question for folks about what are you willing to risk to do this work, And so, yeah, I think if you have a queer person showing up to your practice, you might have to risk something. You might have to risk seeing a different perspective. You might have to risk telling a person that you're not qualified to do that work. You might have to risk being viewed differently in your community. You might have to risk losing some of that thing that feels good to you about being a good person that loves and likes everyone, And I think even sitting here today, I'm really mindful of the fact that everyone in this virtual room is risking something. I'm risking something, about whether or not people identify me in a particular way and what that may or may not look like, for whether or not people invite me to speak in their spaces, or to be their trainer, or to be their consultant. And so I think all of this work, when it's done with a lot of genuine authenticity, it involves risk and it involves a willingness. And I think there's a tremendous generosity in being vulnerable in that way and risking that. I have a tremendous amount of respect for the folks in here. And I think, just existing and just identifying and doing it radically, it's a real cool thing to be a part of. So I'm so pleased.
Thank you, Lisa.
I would say just remind yourself kind of what Danielle was saying earlier is it's okay you don't know it. None of us know it all. So just letting that pressure go of because I'm hard on myself. I'm like, oh my God, I don't know this. What is this term? There's so many, where's the new video? What's the new book? And it's you just got to chill. And remember, this isn't a destination. This is the journey. And we're always going to be learning because it's always evolving. And that's what I want. That's what we want because it always can grow. So just, we have to remind ourselves as clinicians, as people, as anyone, we're always going to learn. And that's okay. And it's okay if you don't know.
Yeah, thanks for putting this together, Jamie. And I'm really honored to be here with some of my incredible colleagues. And I'll just say, you will never, ever regret listening with your whole heart. Just being there with someone, that is priceless.
Thank you.
I'll just add one last comment, and please do your own work. Free yourself of those barriers and those messages and come alive. Find your true self and your kindness and your love again. Do your own personal work.
Thank you. And Danielle, we'll let you have the last word.
Okay, so let's work and honor each other. Let's also learn together. One of the things that strikes me is there's not a lot of research in our area in the EMDR field. and we really need to work together to make that happen. I wanted to thank this panel, Jamie, and like I have had a real wide array of emotions because we touched so many things. There was so much I learned and benefited from today, and I just want to thank everybody for that. So thank you so much.
Thank you, Danielle. And thank you to all of you who joined us. Thank you for your beautiful comments and questions into the panel. I hope you have a chance to go back later and look at some of them because just a lot of appreciation and gratitude offered. So again, please stay in touch, instituteforcreativemindfulness.com. And right here on our Facebook page, you can go back and reference a lot of what I've referenced in this conversation today. Because yes, it is Pride Month, which is one of the reasons we're putting up a lot of this content this month, but I have very strong feelings that Pride Month is every month. Every day is Pride Day to be affirming us and our existence. And again, thank you for your presence and listening today.